Good evening. How are you?
I'm okay. How are you?
Are you Anthony?
Yes.
Hi. I'm Denise. I'm going to be your nurse practitioner. I saw that you came in for your annual wellness visit today. Is that correct?
Mm-hmm.
Awesome. I'm just going to wash my hands. So with the annual wellness visit, I'm going to be touching you and listening to you with my stethoscope. If at any time throughout the exam, if something hurts or causes discomfort, please let me know. This because we'll stop doing that. Is that okay?
Yeah.
All right. So what I'm gonna do first is I'm just gonna look at your face a little bit, and I'm gonna go ahead and touch your head. Is that okay?
Yes.
All right. So you're just gonna feel me just touching any pain or discomfort while I'm touching.
No.
Okay. And I'm looking at just your face and your head, and everything looks like it's symmetrical. And then I'm gonna go right here. These are your frontal sinuses, and I'm just gonna go ahead and palpate any pain or discomfort.
No.
Okay, I'm just gonna, any pain or discomfort?
No.
Okay. And then these are your maxillary sinuses, any pain or discomfort?
No.
And you're just gonna feel me kind of palpating or like patting. No pain?
No.
Okay. And then I'm just gonna come over here. Any pain with your ear?
No.
Okay. Perfect. And then what I'm just gonna do is I'm gonna feel your temporal arteries. And then I'm gonna come down here, I'm gonna feel your carotid. And I'm gonna feel your carotid on this side. And what I'm gonna do, since I'm on your carotid, I'm just gonna go ahead and take a listen. Is that okay?
Yeah.
When I put my stethoscope on, can you just hold your breath, okay? And you can breathe and hold your breath. Perfect. Awesome. Now what I'm going to do is I'm just going to palpate for lymph nodes. So you're just going to feel me back here. Feeling any. I'm just going to come up here. I'm just going to go down and around. And I don't feel any, which is a good thing because we don't want to be feeling a whole bunch of lymph nodes. And I'm just going to come this way. I'm going to try to see if I can feel those deep ones. And I'm just going to go across your clavicle right here. Perfect. Can you do me a favor? Can you push up? Awesome. And can you take your chin and touch? And lean back. Can you look this way? Look that way. Can you push against my hand? And push against my hand. Perfect. Can you touch to your shoulder? And to the other shoulder. Perfect. Now what we're going to do is we're going to move on to your hearing test, okay? So what I'm going to do is I'm going to come behind you and I'm going to whisper something, and I just want you to tell me what I said. Baseball.
You said baseball.
Perfect. I'm going to come over to the other side. I'm going to whisper something over this way, and I'm going to just ask you what I said.
You said peanut butter.
Perfect. And I'm going to come over here. This may seem a little weird. This is called a tuning fork. And what I'm going to do is I'm going to put this right here on the top of your head. I just want you to tell me if you can feel it.
I can feel that.
Okay. And did it stop?
Yes.
All right. And then I'm just going to put this over here, and I want you to tell me when you can't feel it anymore.
Lost it back down.
Can you hear it?
Yes.
Okay. And then I want you to tell me when you can't hear it anymore.
I can still hear it.
It's a good thing because air conduction is longer than bone conduction. So your hearing on this side is pretty good.
wife says I hear everything except for her voice.
Still here?
Now it's gone now.
Alright, so what I'm going to do is I'm going to look inside your ears if that's okay.
Yeah.
Alright, so I always tell everybody try to keep your head still because I don't want to cause any pain or discomfort. And your ear canal is nice and clean. And your tympanic membrane is a pearly white, which is what we want to see. And I'm going to come over to the other side and just take a peek. And this side looks good. Your ear canal now wax, and your tympanic membrane looks nice and pearly white. What I'm going to do now is I'm going to just have you swallow. I'm just going to look at your thyroid. Perfect. And I'm just going to come over behind you. I'm going to touch you on your neck. You're just going to feel me feeling around. It might feel a little uncomfortable. And can you turn your neck like right about there? And can you swallow for me? Perfect. And can you turn to that side and just swallow? Can you do that one more time? Perfect. Now what I'm going to have you do, is I'm going to have you cover your one nostril and just blow out. No congestion, no issues. And on the other one, and I'm just going to take a peek up your nose just a little bit. So I'm just going to put your head back. And I'm just going to look. Everything looks good. Perfect. Now what I'm going to do is I'm going to have you close your eyes and cover one nostril. I'm going to put something under there, and it's going to have a smell, and I just want you to tell me what that smell is.
It smells like cinnamon.
Perfect. And then I'm going to have you close your eyes and cover the opposite nostril. I'm going to put another scent over and just tell me if you can figure out what that smells like.
It smells like my wife's lotion, Cavala.
Perfect. Alright. And then I'm just going to take something that's soft. I'm going to have you close your eyes. And I want you to tell me if you can feel it, okay?
Yes. 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 Yes.
Perfect. And then what I would like you to do is I'm going to take this and I'm going to shine this light in your mouth. I'm going to have you open up your mouth. This is just a tongue depressor. And I just want you to say ah.
Ah.
Perfect. And can you swallow for me?
Bless you.
Thank you. Sorry about that. And can you cough? And can you say, you can't teach old dogs new tricks?
You can't teach old dogs new tricks.
Okay. Can you raise your eyebrows? Then can you smile? Can you frown? Can you blow your cheeks like a fish? Okay. And can you stick your tongue out? And can you move your tongue up, down, side to side, or all around? And then can you take your tongue and kind of push it against your cheek? Perfect. And this side? Perfect. I'm going to go ahead and I'm going to have you open up your mouth. I'm just going to take a peek in there, okay?
Mm-hmm.
So I'm just looking at the mucosa. Any issues with your teeth? Your teeth look good. You said you go to the dentist. Can you lift your tongue up? Perfect. Can you put your tongue back down? I'm going to put this back in your mouth, and I'm going to have you bite down, and don't let me pull it. Perfect. And can you bite down, and don't let me pull it. Perfect. Let go. Awesome. And then, what I'd like to do next is, I would like to these two things. What I'm going to have you do is I'm going to have you put your arms out, circles, wrist circles. I'm going to have you put your arms out like this, something like that. Flare your fingers out and together, out again, up and out. Perfect. And have you put your arms up like this. I'm going to pull back. Don't let me pull you. I'm going to push. Don't let me push you. And then what I'm going to do is I'm going to have you put your hands down and just squeeze my hands. Perfect. What I want to do is I just want to feel your muscles very relaxed. And I got that. And can you tense? Good. And then I just want to go ahead and I just want to look at your knuckles. Any issues or pain in your hands or your joints?
No.
Okay. I'm just going to come over here. I'm just going to look here and just see. And then what I'm going to do is I'm going to just feel your artery over here. Perfect. I'm going to have you put your hand up. I'm just going to feel your artery here. I'm going to feel over here. Got nice strong pulses. I'm going to have you close your hand and then open it up. And I'm going to have you close your hand and open it up. And then I'm going to come over this side. I'm just going to feel this pulse. Nice and strong. And I'm just going to feel right over here. I'm sorry, I'm just going to bend your hand. And I'm going to feel over here. And then I'm going to have you close your hand and open. Perfect. And then close your hand and open. Perfect. And then what I'm going to have you do is I'm going to have you close your eyes. And what I'm going to have you do is just turn your hand over. I'm going to place something in your hand and I just want you to tell me if you can identify it and what you think it is.
It's a quarter.
Okay. And then I'm going to have you open this hand and I'm going to put something in there and I just want you to tell me if you can identify it.
It's a paper clip.
Perfect. And then what I'm going to do is I'm going to have you close your eyes. I'm going to touch you and I just want you to tell me where I touched you. Like point to where I touched you or touch where I touched. Perfect. Awesome. And then I'm going to do another test. I just want you to see what I'm doing. This is considered soft and this is considered hard, okay? I'm going to have you close your eyes and I want you to tell me if it's hard or soft.
Soft. Hard. Soft. Hard. Soft. 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 Hard. Soft. Hard. Soft. Hard. Soft.
Now what I'm going to do is I'm going to have you close your eyes. I'm going to write something in your hand and I'm going to ask you if you can identify what I'm writing and it's going to be a number.
8.
Perfect. And come over this side. This time it's going to be a letter.
E.
Perfect. Now I have a little piece of cotton
Mm-hmm.
and I just want you to tell me if you can feel this.
Yes. 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 Yes.
Perfect. All right. What I'm gonna do is I'm gonna put this on your knuckle and I want you to tell me if you can feel it and then I want you to tell me when it stops. But I need you to close your eyes.
Can feel it. Stopped.
Okay.
Can feel it. Stopped.
Perfect. Now, I know you said that you wear glasses for corrective lenses, correct?
Yes.
Would you like to wear your glasses? Because I'm going to do an eye exam.
Sure. Thank you.
You're welcome. So this is like a mini Snellen chart. We have to hold it about 15 inches away from your face. And what I'm going to do is I'm going to have you close one eye. And I'm going to have you hold this in your hand. And what I would like you to do is try to read that line there.
FEZPDT.
And then the next line.
ECTPNL.
Okay. And can you close your opposite eye? And then can you try to read that line?
FEZPDT.
And try to read that line.
ECTPNL.
Perfect. You got 20/20 vision with corrected lenses. And what I'm going to do is I'm going to have you hold that about there and just read that top line for me.
BLS, healthcare provider.
Perfect. And then I'm going to have you take your glasses off.
Okay.
And what I'm going to do, some people say that this might be a little uncomfortable. I'm just going to check your eyes, okay? So,
It's not too bad. I've been through it before.
I apologize. You know, some people say it's very uncomfortable. What I'm going to do, I'm just going to palpate a little bit around your eye. And then I'm just going to look. Your sclera looks good, nice and pink in there, conjunctivi. And now what I'm going to do, I'm going to set this to 0, and I'm just going to take a peek inside your eye. So this might be a little uncomfortable because it's kind of a bright light. I'll try to be as quick as I can because I know it's not the most comfortable. And I'm just going to come over and just go in. Thank you for looking straight ahead. And usually this is better when it's in a darker room, but you got a really good red reflex. I'm just going to come over and just go in. Looks good. So that's good. And now what I'm going to do is I'm going to have you look straight ahead. And without moving your hand, I'm going to have you follow my finger. Okay? With your eyes. Don't move your head. Perfect. I did not boob you. Now what I'm going to do is I'm going to actually have you, I'm going to check your peripheral vision. So my fingers are going to be like this. And what I'm going to do is I'm going to come in from different fields, and I just want you to tell me when you can see them, okay?
Okay. I can see them. 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 Now. Now. Now.
Okay. Perfect. And then the next thing that we're gonna do is it's gonna feel like 2 sharps, but what I want you to do is tell me if you feel 1 or if you feel 2. But I need you to close your eyes. You ready?
1, 2, 1, 1, 2, 2, 2, 1, 2, 1.
I'm gonna come over this side and same thing.
2, 1. Just felt like 1. 1. 1. 2. 2. 1.
close your eyes, and I'm gonna take this and I'm gonna put it on a knuckle, and I want you to tell me when it stops.
I can feel it. It stopped. I can feel it. It stopped.
Okay. I want you to keep your eyes closed. I'm gonna move your finger, and I just want you to tell me what direction I'm moving it in.
Up. Down.
I'm gonna do it over this side.
Down. Up.
Perfect. Alright. Would you mind taking your shirt off
Sure.
for the next part of the exam? Okay. Now what I'd like you to do is, can you reach your hands over your head? And then can you take your hands and just put them at your shoulder? On your hips, I meant.
I knew what you meant.
Alright. You can relax. I'm gonna go ahead and touch you if that's okay.
Sure.
Alright, so just going to the clavicle. So you're just gonna feel me. No pain or discomfort?
No.
Alright, I'm just gonna go ahead and take a little listen. So, I'm just gonna go like right about there. You can feel I'm adjusting the pressure because I'm using the diaphragm and the belt. Can you do me a favor? Can you lean forward? Okay. And then I'm just going to come up here. Perfect. And now I'm just going to come this way. This is going to be a little bit weird. What I'm going to do is it's called concussion for your lungs, so it might be a little weird. I'm just going to come over here. Okay. And now I'm just going to listen to your lungs. So I'm going to start like right above here. Can you take a deep breath? And again. One more. I'm just going to go right here. And I'm just going to go over here. And then what I'm going to do is I'm going to ask you if we can kind of turn your chair around a little bit, just so that we can see your back. Would you be able to sit like this way? Kind of? No, back turned this way.
Absolutely. Ah, okay.
so much. And then you're gonna feel me percussing again. And then I'm just gonna listen to your lungs. Can you take a deep breath? Deep breath. And a deep breath. Another deep breath. And another deep breath. Perfect. I'm just gonna go right here. You might feel a little discomfort. Any pain?
No.
And any pain?
No.
Okay. We're gonna cut. So what I'm gonna do, my hands might be a little cold, so I do apologize. I'm just gonna come down here and I just want you to go ahead and take a deep breath in and a deep breath out. One more time. Perfect. And then, can you do me a favor? Can you say 99?
99.
Can you say 99?
99.
Can you say 99?
99.
And one last time.
99.
Perfect. I'm going to go ahead and I'm going to percuss your lung field. So you're just going to feel me tapping. And I just want to come over on this side. Okay. And now I'm going to ask you to take a deep breath in and hold it. Perfect. Let that go. And I'm going to mark like right here. And what I'm going to ask you to do is take a deep breath and then let it out, and then hold it when you let it out. Hold it. So it's about right there. I'm just going to take my little, you can breathe normal. So it's about 2.5. That's good. Okay. And then I'm just going to listen to your lungs. So I'm going to have you breathe normal. And breathe normal. Breathe. And breathe. And breathe. And breathe. And breathe. Good. One more time. I'm going to come over here and I just want to listen. Breathe. Perfect. And no pain in your back?
No.
Nothing when I go like this. And then I'm just going to check your CVA tenderness. Just let me know if you feel any pain. No pain?
No.
Perfect. Now we're done with your back. So what I'm going to do is I'm going to have you come and lay down on the bed over here with your feet kind of facing, yep, perfect. And what I'm gonna do is we're gonna do a breast exam. I don't know if you've ever had one, but I am gonna kind of put this there, and a pillow. I'm gonna have you lift your arm over top of your head, just one.
Okay.
Alright, so what I'm gonna do is you're just gonna feel me right up in here. I'm doing a little bit of light pressure and a little bit of deeper pressure. I'm just checking to see if there's any lumps or bumps. No pain, right?
No.
No pain?
Nope.
Now what I'm gonna do is I'm just checking for lymph nodes. You're just gonna feel me kind of in your armpit. So I do kind of apologize.
Glad I showered today.
And then I'm just gonna go to the outside. And I'm just gonna go down. And then you're gonna feel me right here on the back of your humerus. And then I'm just gonna go right here on your elbow. I don't feel any, which is good. Now what I'm gonna do is I'm gonna have you put this arm down. I'm gonna lift you up just a little bit, and I'm gonna put this one just under there, and then I'm gonna have you lift that arm up. And I'm just gonna do the same thing on the other side. And you're gonna feel some light pressure and a little bit of deeper pressure. And I'm not causing any pain.
No.
And this is why GYN offices always have like a sign on the ceiling. Or like a picture. And I'm just gonna go right here. We're gonna go to the outside of the axillary. You're just gonna feel me just kind of feeling around. And you're gonna feel me going over to the side. And here. And then just the arm. And they did say that men don't normally have breast cancer, but 1% of men do develop breast cancer, so it's always a good idea to do self breast exams. But usually men get it more around the nipple area. I'm gonna go ahead and move on to your abdomen. So what I'm just gonna look is I'm just kind of taking a peek at your abdomen, just to make sure everything's okay. No pain, right? Okay. So what I'm gonna do is I'm gonna go ahead and I'm gonna listen to your abdomen. Is that okay?
Yes.
So you don't really have to do anything. You can breathe normal. And since I'm listening to your abdomen, I'm just gonna listen here. I just wanna see if I can hear your aortic artery, your aorta. And I'm gonna listen for your renal. Okay. So we did do that. And then what I'm gonna do is I'm just gonna percuss a little bit. So you're just gonna. And what I'm gonna do is I'm gonna go right here, and I'm just gonna percuss, just to find the measurement of your liver. That's probably the base. So I'm just gonna mark right here, and then I'm gonna come up. That's probably like there. And I'm just looking for my measurements. I'm gonna do that over again because I did not have my measurement. So let me go back. We're at about 6. So it's about right. Okay. And then what I'm going to do is I'm going to have you turn a little bit to the side. Turn just not all the way, just a little bit. Okay. I'm just going to percuss for your spleen. I believe it's like right there. So I think you're good. And it doesn't seem like it's enlarged. And then I'm just going to palpate your stomach.
Okay.
So you're just going to feel me. It's going to be like light touch first. Any pain or discomfort. And you're going to feel a little bit deeper. And now what I'm going to have you do is I'm going to have you tilt your hips to this side. Yep, just your hips, just a little bit. I'm just going to come over, I'm going to listen to you. So I'm just going to go right about there. Can you turn a little bit more? Just, yeah. There you go. Okay. Awesome. So you can straighten yourself, but you're going to stay laying down.
Okay.
Alright, so there's a couple things, since we haven't did your legs yet, that I still need to do. So, I know, we had done the test where I had said, soft, sharp, okay? So I want you to close your eyes and just tell me if you feel something sharp or soft.
Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. Sharp. Soft. Sharp. Sharp. Soft.
Perfect. And then, what I'm gonna do is I'm gonna place a tuning fork on your toe, and I want you to tell me if you feel it, and then I want you to tell me when it stops, okay?
Okay.
Alright. Feel it?
Can feel it. Stopped.
Okay. And then I'm just gonna do the same thing on this side.
Can feel it. Stopped.
Perfect. And then there's a couple things that I want you to do with your feet. The first thing that I want you to do is, can you push against my hands? Okay. And can you pull against my hands? And can you push your feet all the way down? And can you pull them up? And can you make them go around in a circle? Awesome. Now, the other thing that I want you to do, you can stop doing that. I want you to bend your leg. And can you straighten it out? Can you move it to the side and inside and around and around? And then the other leg I'm going to bring up. Can we do the same thing with this leg? Perfect. And then what I want to do is I'm going to check your deep tendon reflex. So I'm going to have you put your arm down and just kind of relax it. And I'm just going to, don't focus on me, look away. Perfect. And then I'm just going to come over here and just going to and then I'm going to do the other side. Just relax your arm. Okay, and then I'm just going to go right here. Perfect. I'll do your other ones when we stand back up. I'm going to have you stand up. I'm going to adjust the camera just a little bit so that we can see feet and everything else. Alright, so what I'm going to do is I'm going to have you sit at the bed, and I just want to make sure you're on camera. Alright, so what we're going to do is, the first thing we're going to do is I'm going to do hand taps. So I need you to look at me. And we're going to do perfect. And then what I want you to do is I want you to go perfect. And now what I want you to do is touch your nose. Now close your eyes and touch your nose. Now open your eyes, and I want you to touch my finger with one finger. And perfect. And then what I want you to do is I want you to stand up, and I'm going to have you face this way. I just want to kind of take a peek at your back. And can you bend forward? I'm just checking your spine. No signs of scoliosis. Can you bend back a little bit? And then can you twist at your hips, like kind of roll and twist, and you can bend. And then what I'm going to have you do is I'm going to have you walk. So if you can go here and just walk to the end of the bed. All right. Now the next time I'm going to have you walk, but I want you to walk toe touching.
Okay. Just gonna start back here.
No, you can just.
Oh, I'm already back
That's
here.
okay. So toe touching, perfect. Now when you get to the bed, I'm gonna have you turn around, and I'm gonna have you walk on your tippy toes. Tippy toes. Now can you walk on your heels back to the end of the bed? Perfect. Now on one foot, can you hop? Okay, and now with the other? Okay. And then what I want you to do is, can you hold on to the bed and just flex your hip backwards? Yep, and do the other leg as much as you can without kicking something. Perfect. And then what I would like you to do is, just going through everything. Okay, can you do me a favor and can you squat down? Perfect. Can you put your hands out like you're holding a pizza box? Close your eyes. Okay, and then I'm gonna have you sit down. You can sit right there.
Okay.
I'm just gonna check my camera just to make sure your legs are in. Okay. What I'm gonna do is, I kind of want your legs to dangle, so I need you to come off the bed a little bit, like just have them dangle, don't touch the floor.
The problem.
Okay. Move up a little bit.
That's what I was trying to do.
Alrighty. So I'm just going to have you. Here, I'm just going to put my hand like this. Okay. And then I'm just going to put my hand here. Alright. And then I'm just going to come back here and put your foot right there. You relax. You have a really good reflex there. And then I'm going to come over here. Okay. And what I'm going to do is I'm just going to feel for your pulses. So you're going to feel me back in here. I apologize. There's a lot of soft tissue. You have a nice strong pulse. And I'm just going to come back here. And then I'm just going to come back here. And right there. And your temperature of your legs feel good. No swelling, no edema. And then I'm just going to go right here. Sounds like you have a little cold going on. And that's it. All right, thank you. I'm going to hold your foot and then I'm going to do this one. Are you ticklish?
A little bit.
Okay. And then we got that done. And trying to see, is there any questions that you have for me with your physical?